Good day, everybody, and welcome to OEM 242. This is your field internship. Congratulations on getting through paramedic school. This is the next to last obstacle of completing your internship and showing that you can function as a competent entry-level paramedic team leader. The focus of this course is going to be less on teaching you and more on you showing us, more specifically, the preceptor that you're going to be assigned to, showing them that you are capable of running a call more or less independently with a minimal amount of intervention from your preceptor. We'll go into more detail into some of the specific requirements of this particular course when we go through the syllabus and when you have your preceptor meetup day. But what I'd like to talk about today is how you're going to set up your binder for the internship. So this is the setup that I'm going to see and I'd like to see, and when I meet with you at least once a week, I will expect for you to have all the shifts that you have completed prior to meeting me put into your clinical binder in this way, so we can review your shifts, your evals, your self-evals, your charts, etc. together. We can identify any issues and also identify areas where you're doing very well. So if we look at this is just a sample here. This is a completed clinical binder, and you won't have this form until the very end. This particular form right here is your final field/clinical psychomotor skills evaluation. This will only be done at the very end of your internship. To complete your internship, you need to complete a minimum of 112.5 hours. And after you've completed those 112.5 hours, that's going to be 10 shifts if you're working 12-hour shifts. And I know a couple of you will be working 24-hour shifts, and that'll be at least 5 shifts. So at the end of that rotation, you will sit down with your preceptor, and your preceptor will do this comprehensive end of rotation skills, psychomotor skill evaluation. I'll talk about this in a little more detail here in a little bit, but let's just talk about what your day-to-day binder should look like. Okay, so it should look like something like this. You should have some sort of page. Okay, this is just real low fidelity, but it works. Okay, so this says day 9, 21 August 2029. Okay, so this is the 9th day of your internship, we'll say. Okay, and the very first form that you should have filled out and completed, and again, this is for every single shift that you do your internship, is the field attendance voucher. Okay, you will put your name, okay, Jane Doe, the date that you did your shift, your preceptor's name, and your preceptor should either sign or initial here, okay, that they actually filled this out. The unit that you're writing on, so this is Medic 7, and then your preceptor needs to sign whether or not you were on time or tardy, when the shift started, when the shift ended. Okay, so this is the very first thing you want to see right behind kind of the cover sheet for each day. Okay. The second thing that I want to see is the student self-evaluation. Okay, so you as the student, Jane Doe, John Doe, etc., you will evaluate yourself in this shift. Okay, so on a scale 1 to 4, okay, this particular person rated themselves as a 3. They identified a situation where they felt least competent. They had to mix and hang an epinephrine infusion. And that was where this particular student felt weaker. Where they felt most competent was when they made the call to transport a status post ROSC patient with a suspected STEMI to the heart hospital for PCI intervention. And then list at least one goal. This student identified, hey, I'd like to work on mixing and administering medication infusions. And how are they going to meet that goal? Well, they're going to discuss mixing and hanging at least one common drug with their preceptor for the remainder of their internship. So one common drug per shift. So that's kind of how this student worked out. So that's the second form. The third form that I'm going to want to see is the form where your preceptor will evaluate you for every shift. Okay, So you put the date, your student name, the preceptor name, the unit, and then your preceptor will check yes or no if you generally did okay here. If there was a no checked somewhere where there was some specific area where you had an issue, your preceptor needs to address that. Okay, so did the student successfully lead the team during the patient encounter? Yes or no? Okay, so if you as a student did for all patient encounters, this needs to be circled. If there was some issue where you were not able to run the call, okay, the no needs to be circled, and then your preceptor needs to write specifics. Okay, what happened? Why were you not able to run that call? Did they need to step in? Was there some issue? Okay, and then if there were issues, they should be identified, okay, by both you and your preceptor. Okay, again, this is your preceptor writing here, identifying an issue, and then how are you going to work to resolve that issue. Okay, so in this particular case, overall was good. The preceptor said made a good call transporting the ROSC patient to the appropriate facility, struggled a bit mixing the epinephrine drip, and that does kind of go along with the student's self-eval that they said, hey, I had an issue here. Okay, the preceptor also identified that. So what are we going to do? Well, we're going to work on mixing and hanging infusions. This goal is a work in progress, and we're going to review at least one drug a shift. Okay, and then the preceptor signs and dates. And if there's a major issue, does a preceptor request a meeting with the clinical coordinator, yes or no? Okay, if there is a major issue, they may select yes. Okay, and then we'll have to set up a meeting. In this case, no. And then you need to indicate the paramedic student's level of participation. Now, remember, you as a student during your internship, okay, your goal is to be a lead medic. Okay, now it doesn't necessarily mean that every call has to be a code or an ALS call. Okay, this particular shift had ALS calls, but you may run a shift where you only do BLS calls. So be it, right? As a paramedic, it's not only ALS that you're expected to run. It's BLS, it's ILS, it's ALS. It's the entire gambit of potential situations that you have to manage and deal with as a paramedic team leader. Okay, so just because this gets selected, that does not mean that you are failing your internship or that you will not successfully negotiate your internship, right? We understand that a lot of calls are going to be BLS, and you may have a shift where you only run all BLS calls. So be it. That's all right. Okay. We would expect a mixture of BLS calls and ALS calls, but more specifically, what we're looking for is you as a student in the leadership position, right? Leading that call, making the decisions, delegating. That's what we're looking at. Okay. If you only are an observer, okay, that is not necessarily making good progress in internship. Okay, the time for observation is more or less over. That's not a critical part of this. Or a participator in care. This may or may not be an issue here. For example, if you opt to intubate a patient, then you may be participating in care by intubating. But in that case, you can still intubate a patient or perform some intervention and still be the lead medic. Okay, but if all you did was participate and perhaps your preceptor had to take over and had to direct you what to do, and so you weren't in that lead position, then maybe that's selected. But this is really what we're looking for, is you to be a lead medic on either BLS or ALS predominant shifts. Okay, so there's that. The second part to this this particular form here, okay, that your preceptor fills out is this right here, okay? And so this is a second form to that. So in this area here, the D chart area, what I'm going to want you to do is whatever chart you did for your shift, or if you had 3 patient contacts that shift, you will print off those 3 charts from FISDAP. So you'll enter the charts into FISDAP. like you have normally been doing, and then you'll print those charts off and you will put those charts in this section right here. Okay, and then in this area here, what you'll do is down here, did you follow any specific protocols? Okay, so were there any special situations? Did you follow more than one protocols? Did you have to contact medical control? And if so, who did you speak with? And were you given any orders? Okay, so this area here is you're not going to do your D chart in this area because you're attaching your charts, but rather you are going to document. Okay, you and your preceptor will be documenting any special circumstances. For example, in this case, that the student followed ACLS protocols and guidelines for VFib, VTAC arrest and return of spontaneous circulation. And then they followed hypotensive status post-arrest protocol when the patient failed to respond to fluid resuscitation. Okay, so these are more special circumstances. This could include endotracheal intubation or insertion of a supraglottic airway or administering a medication or following some protocol that you don't normally, that you don't run into in your day-to-day practice. That would be there. And then finally, you need to sign as a student, and then your preceptor needs to sign. And that's what needs to be for every shift that needs to be present. And then at the very end of your internship, okay, you've completed your 10, your 5 or your 10 shifts, or however, it needs to be at least 112.5 hours, however, you will get with your preceptor, you'll sit down, and your preceptor will fill out this final field evaluation, okay, a 1 to 4, 1 being dangerous and 4 being completely proficient. Are looking for our cut as 3 and above, so acceptable. Okay, acceptable and above is what we're looking for. So you have these general categories here: patient assessment, history taking, airway management, IV related, medication administration, ECG recognition, and then overall student knowledge. Again, we're looking for a 3 and above in these particular areas. If there is anything less than a 3, okay, comments are needed. Your preceptor is going to need to make very specific comments, and they may even want to attach additional pages of documentation if that's the case, because that indicates that there is an issue. Okay, and here this is an area for any specific comments, but again, because this is all 3 and above, this doesn't need to be. Doesn't necessarily need to be very detailed. It can be, and you can attach your preceptor can attach additional sheets. Okay, so here, very punctual, empathetic professional, struggled a bit with medications, but has improved significantly, and we saw that in the daily eval there, and will make a competent entry-level paramedic. And 3, okay, so your evaluation recommendations for progression, entry-level ALS competence. So we're looking at 3 and above. Okay, so this is someone who can enter as an entry-level paramedic. Your preceptor signs, you sign. This gets dated, and then it needs to be signed by a reviewer. That'll ultimately be either Art Guzman or myself signing these. The second page is the affective aptitude evaluation. Okay, and again, these areas are a 1 through 4 area, and these cover things like initiative, integrity, patient advocacy, dependability, communications, respect, etc. Okay, these are more affective and behavioral things, more overall professionalism. Are you showing up on time? Are you being professional? Are you being empathetic? Are you able to communicate effectively? Okay, and again, it's a 1 through 4 and 3 and above. Now, I will say that if you are late or you miss more than 1 shift without good cause, i.e. you are sick and you have physician documentation, that will be considered grounds for not successfully completing field internship. Okay, at this point, we're not looking for showing up late and those kinds of things. This really is very much like a probationary period at a job. If you get a new job, there's generally a probationary period. where you show that you are going to be capable at performing that job you were hired to do. And this is, in essence, very similar to that, that you are now showing that you can be a professional, competent, capable entry-level paramedic. Okay, hopefully you guys found this video helpful, and hopefully this answered any questions you have about how you need to set up your portfolio for internship. Okay, we'll see you all next week for the introduction and syllabus review.